10th Sustainability Lunchtalk. As usual, this Lunchtalk is recorded and will be uploaded on the sustainability webpage of the university in the coming days. Please be aware that we will not take questions during the presentation, as a dedicated time will be taken at the end. So if you have any questions during the presentation, feel free to write it in the chat and we will pass them to Professor Friedel. My name is Mathieu Gilleron and I'm the project manager in sustainability for the University of Luxembourg. With my colleague Laurent, one of our missions is to raise awareness on sustainability among the community. To help us, we have the chance to be surrounded by brilliant professors and researchers. For the last Sustainability Lunchtalk of 2023, we wanted to highlight a recent addition to the academic world of the university. Indeed, in September 2023, 4 new bachelors in nursing science opened. You might be wondering, why a Sustainability Lunchtalk about it? Well, first, because Professor Dr. Marie Friedel, one of the study program directors and the host of the day, contacted us. And second, and most seriously, because those bachelors fully represent what is sustainability. Indeed, it is not just a matter of ecology, environment, health, or people, it's all at once. It is a global approach to addressing problems. Those bachelors don't have a basic introduction to sustainability class. No, they include an Econursing module. I could define it right now, but I'm pretty sure Professor Friedel will do it way better than me afterwards. What I can tell you is that I attended a class and I saw the concrete link between nursing science, the nursing profession, and sustainability. The student did a walking diagnostic around the Belval campus, and their observations were way different than mine. Indeed, they talked about air quality, noise pollution, light pollution, and the global environment and its interaction with health and feelings of the people. Econursing is the concrete integration of sustainability into the way of working and living. And you will soon learn that it's even more than that. Our host for this lunch talk will be Professor Marie Friedel. In August 2022, she was appointed full professor at the University of Luxembourg with the mandate to implement those new bachelors in nursing science. Her research is focused on pediatric palliative care, patient-centered outcome measures, quality of life, clinical ethics, and spiritual care. Our co-host for the day will be Professor Klaus Vögele. He is full professor of clinical and health psychology at the Faculty of Humanity, Education, and Social Sciences. He is head of the University Institute for Advanced Studies, and he is the director of the master program in psychotherapy. Without further ado, Professor Vögele, the floor is yours.
Thank you very much, Mathieu. I'm very honored to have been asked to chair this session. It's a warm welcome to everybody. Indeed, the topics that you just mentioned are very close to my heart, but I never managed to get them together. So I really look forward to Marie's presentation, where she will talk about sustainability, healthcare, the environment. Again, all strands of research that have kept me busy over the last few years, but not from a perspective where I was trying to integrate all these very, very interesting and important issues for our society. I'm acting as the chair of this session, so everybody please feel free to ask questions by entering them into the chat. I will try and act as a facilitator after Marie's presentation by forwarding your questions, and I will try to moderate the discussion. I will also keep a close eye on the clock because we will have to finish on time, which is probably supported by Mathieu, but I also have to leave at 1:30 because I'm teaching. All right, without further ado, the floor is yours, Marie.
Thank you so much, Klaus, and thank you also to Laurent and to Mathieu for this invitation. I feel really in good company this midday, and thank you also for all those who joined us now during your lunchtime. I will now share my screen with you, some slides that will be also available to you afterwards if you like. I think this is what we discuss together with Mathieu with the accordance. So, sorry, so I was, yes, it's true, appointed as full professor in nursing sciences with my close colleague, Professor Dr. Laurence Bernard, at the same time, and we have indeed this difficult and challenging task and exciting task to implement new bachelors for nursing science. In this presentation, we'll tell you a story of a greenhouse, because it's about a new course, which we called Econursing, but it's rooted also in our adventure. How did we arrive here in Luxembourg, and how did this crazy idea to start academic bachelors of nursing science here at the University of Luxembourg? So see it as the sharing of a story today. The plan will be the implementation of the new bachelors, but also this urgent need to promote environmental health. The COP28 reminds us in those days, and also then a more detailed presentation of the new course in Econursing. As you know, we are facing a massive nursing shortage. We're talking about 10 million nurses who are lacking at different places, almost in hospitals. And there was documented evidence to call to invest in healthcare education, and in healthcare education to higher the quality and the standards of the nursing education. Different studies showed that when we increase the quality of the education and of the quality of the profession of nurses, we can have an impact to reduce morbidity and mortality of patients. We saw also that there is a link between the means and the conditions in which nurses can work, the quality of care they can then provide, and their nurses' well-being. So everything is linked. We saw also, and this is known and was spread, that different elements can help to improve attractivity and retention of the nursing workforce, as for example, offer academic career opportunities at university, to have also professional autonomy, to have recognition and support of our own discipline, to have equitable work conditions and an equitable salary, and also to have a feasible work-life balance. I was very appealed by this image we've seen during the pandemic, in who showed the isolation and the solitude of many, many persons who died alone because of the nursing shortage, but it was amplified by the pandemic. That's why in Luxembourg, as we know that there's more than 70% cross-border nurses, and with the pandemic, it threatens the healthcare systems here, the hospital systems in Luxembourg. The LAIR report issued in 2019 showed that there was a need to improve the education for nurses. And also there was a strong lobbying and a long work from the National Association of Nurses here in Luxembourg to say that there should be implemented academic bachelors for nurses here in Luxembourg. That's why the University of Luxembourg received in 2021 the mandate to implement new bachelors. And here you see the diagram which was proposed by the ministry to have those bachelors with a direct access in the second year for pediatrics, psychiatry, anesthesia and resuscitation, and also the operating room, which is called ATM de chirurgie. We tried in a very, very short time frame to start a collaborative approach to create different groups, discussions groups with ministries, with professionals, with associations, with hospitals representatives to elaborate together those new programs which should be implemented then, and we started in September of this year. It was implemented and rooted within the Faculty of Science, Technology and Medicine, which is multidisciplinary and has a double mission for education and research to produce and disseminate knowledge and to train responsible citizens. And it's quite a real opportunity to intertwine the quality of care based on evidence-based education, nursing practice, and this also through research, because through research we can have access to the last innovative means and methods to provide excellent care. But what are nursing sciences? We discovered that this term was quite new for some of our colleagues here at the university. It's about empirical knowledge, ethical knowledge, aesthetic knowledge. That's why also I need some flowers every morning here besides me in my office. But also personal knowledge. We are not one individual or one professional. We are a whole human being. And we also recognize this within the patients and the families we care for. And also emancipatory knowledge. As you know, the nursing profession has a long history about monastery service and benevolent work, and this is still a mark, and this prints us till now. It's based, all the curricula are based on the competence approach and not only about some, I would say, acts which are needed within bedside care. Our vision was based on an important document which we shared this vision. It's from Cynthia Fleury and Antoine Fenolio. Cynthia Fleury is a philosopher, a French philosopher and psychanalyst, and they pointed out 10 important basic elements which cannot be stolen. And we are quite in accordance with those 10 elements, which you can see them here on the slides. We translated it within a little plant because we see our little unit as a little plant which will grow with the support of the university, but also our so many stakeholders here in Luxembourg. It started also with collaborations, of course, and so the LTPS, which is the Lycée Technique pour Profession Santé, worked already more than 30 years to train nurses here in Luxembourg. And this important fact should not be forgotten, and we need to collaborate to have this transition which gives meaning and gives sense to our new students. Here you can see the tree which we adopted here in Belleval, and where we put also like a ritual, this plaque, I don't know how we can call this in English, which marked the foundation of the nursing sciences here at the University of Luxembourg. And here you see only a part of our team, which is composed with our colleagues from the LTPS, but also PhD, postdoc, and administrative staff. Here you can see a photo from the first academic entry last September. So 4 new bachelors, as we already said, and we also thought that it would be very important to have one professional Luxembourgish nurse linked with one of our students here at the university, to have those bridges, which is a transfer of competence, but also a moral and supportive support during their 2 years, coming years. We developed also some research areas which help us to build new curricula for nursing sciences, which are mostly, of course, for bedside care nurses. This is the main objective within our programs. So this is the second part of my presentations. It's the urgent need to promote environmental health, and we want to link it also with some inner ecology, as I will tell you afterwards. So the origins of greenhouse gases in the healthcare sector are shown here in this graph. And you see that the medicine, the pharmacology, is the most important element which impacts the amount of greenhouse gases. The Lancet Countdown report strengthened the very important actions which must be now very urgently implemented to have more greener, people-centered cities and low-carbon diets, for example, to improve physical and mental health. We have also, as you know, the Sustainable Developmental Goals, which are linked to health, of course. The SHIFT projects, which assembles also different actors and activists to help us to make these changes in the healthcare sector. And very recently, it was a few days ago, the International Council of Nurses called the COP28 not only to have some theoretical elements spread down, but really to have an action plan to concretely have different measures in the healthcare sectors. So the curriculum framework for Econursing was based on those different papers, which provides really concrete, I would say, topics to discuss and to train and to have some competences for nursing students to gain. For example, here you will see the planetary health education framework with interconnection, of course, with nature, but not only. There are also social aspects, as you see, for equity and social justice. And there we can, for example, think about community healthcare, but also the prevention and the salutogenesis from Antonovsky, from which I will talk later on also. There's another aspect which is really important and maybe a bit taboo. It's reducing low value care. The best care, or the care which has the less impact for our environment, is the care we will not provide, we will not give, we will not offer. Different studies from Brownlee and Grimshaw showed that 20 to 30% of care provided is not required, is potentially harmful, and represents also high costs. So this threatens really the sustainability also of healthcare systems. But what is value-based care? Value-based care would be is to measure improvement in a person's health outcomes for the cost of achieving that improvement. And this should be in the next year really the strategy adopted by ministries of health of each country. I also appreciate this suggestion from Bodenheimer, who is a physician and who talks about 4 different elements. It would be patients' quality of life, quality of care, the cost-benefits balance, but also the quality of life of healthcare professionals. And here we're talking about nurses, which are important to take into balance always if we want to build a resilient and sustainable nursing workforce. And I would like to add a 5th element, which is equity in care. And we talk here about inclusion, about diversity, and also really about the primary healthcare sector, which should be improved. Now, the last part would be the presentation of the new course we wanted to build and to offer in Econursing to all bachelor's nursing students. It's a 55 teaching units course for 2 LCPS, common to all 4 bachelors, and we have invited and we had the opportunity to have very good experts who helped us to build this course. The exam is an individual written essay. We want to help them to tackle complexity. Complexity, and it's the French philosopher Edgar Morin who defines this, is what is woven together. And you see here a human cell. If you put a human cell in a very acid liquid, it will be destroyed. On the other hand, if you put it in a very alkaline environment, it will also be destroyed. So we need to find this interconnection and a certain type of equilibrium between we as human beings in our environment. And this is an iterative, I think, dynamic way. You probably know also this model from Bronfenbrenner's ecology and ecological theory, with all these different systems who interact all together. I like also this image I've seen in Montreal. It's a fountain, and you can see that the fountain receives water, but also well spread water. And I think as a nurse professor, but also with our students, we try, and it's our aim, to help them to be aware about what they can give and what they are receiving, in fact. And if we can help them to identify those elements, I think the balance of a certain homeostasis can be reached. So there are 3 interconnected dimensions in the course Econursing. It's talking about the inner ecology, the relation with other human beings, and the environmental health, and also the concrete actions we can take as a nurse. We had the opportunity to have the support of Frederica Roberts, who based her course, her interventions about all the evidence-based practice directed to nurses. And here I would like maybe also to highlight, for example, the emotional intelligence, the connectedness, the self-compassion, but also the sense of coherence from Antonovsky, which helps us to find some meaning in what we are experiencing and how we can have control about some elements and then to invest them, and also to let go maybe some elements from which we do not have any control. We also had the integration and the expertise of Philippe Perrin, who is the only eco-nurse in Europe, and who built a very strong, I would say, educational course in France about eco-nursing. And so he gave very concrete examples as a pediatric nurse or an operating room nurse or a psychiatric nurse, where they can influence some changes in their hospital environments or in, for example, home care settings also. And lastly, with Gaël Brûlé, who is a sociologist at the Haute École Santé Genève and who makes the links from several years ago already now between the environmental health, but also the well-being of human beings. We addressed, for example, also the very huge problem among students, among adolescents, which is eco-anxiety, and how as nurse we can promote or reduce, I would say, the eco-anxiety through the different, at different levels. At the end of this course, it was a whole day. We had the very supportive help of the ASBL La Fresque du Climat here in Luxembourg to help students to make the links between the different elements, the greenhouse effect, but also the different, I would say, dietary means and the impact on our environment. Lastly but not least, as Mathieu already shared it with you, we invited students to make a walking diagnostics here at the Belval campus and to notice everything which was, I would say, uncomfortable for them through their 5 senses, and then to collectively give a feedback to the sustainability team of the university. This helped to identify which are the elements also we can report on and to which persons it is needed to be done. This was only a very sketch note about a conference we did before about this course. And I would like only to highlight maybe the very central image about what we can give and what we can receive. And if this is balanced, I think we can really improve the sustainability, I would say, for nurses here in our country, but also maybe elsewhere. So thank you very much for listening. And I think we can have now a discussion part. I leave you with this very nice image I like personally about the dance from Henri Matisse, in which is indeed a nursing theory, which is called the dance of caring from Boyken and Schoonhofer. So thank you very much, Mathieu and Laurent, again for the invitation. Thank you, Klaus, to be with us today, and also to the government of Luxembourg, who really wants to support the implementation of bachelors of nursing here in Luxembourg, and to all supporters of our little nursing science units we call Greenhouse. Thank you.
Thank you very much, Marie. That was fascinating. I probably have 175 different questions, but we have one from the audience already. And the question reads, what was the main feedback from this walking diagnostic?
So I guess it is to have more details about what is meant or which objective it would be. Yes, so it's a tool we are using in community health. So if a nurse, for example, would be in a home care setting, to see for an elderly people, which are the different elements which could be potentially a threat. For example, when they are walking within their bathroom or their kitchen, which are the dangers and how we can change or improve something in their environment. But it can also be maybe in a hospital to see, okay, what I am seeing. I'm seeing that there are only plastic, for example, used to provide water to patients. Can we change something, or why? How are we? What are we doing with our waste? Can we maybe improve it, and how? Which are the persons who can do that? So it's really using our 5 senses within a specific environment for one human being or a family or a community, and to see how it can impact their health, but also their well-being, and find with them maybe some elements which can be improved.
Okay, are you ready for the next question? Which reads, 20 to 30% of care provided is not required and is perhaps even potentially harmful. If they are not required and harmful, how come someone performed them?
This is a very sensitive question.
Absolutely,
I
it's a
think,
very
as you know,
it's a very political question, probably.
yes, but let's address them too, and let's discuss it transparently. I don't probably have the overview of all elements, but I do have some of them. And I would say that, of course, health is linked to economy, and the way healthcare professionals are paid sometimes depends on external factors. And the way the salary, for example, would be provided depends sometimes also on how they will provide some prescriptions. So there is, of course, sometimes conflict of interest, personal interests, who are more important than maybe community interests or sustainability of the health system itself. For example, we know that there should be a shift in the next years for community health and for home care sectors, and less within the hospital sector. We know, for example, that reducing the different entries at the emergency department can save money. So we can provide other models to prevent and to redirect patients sometimes elsewhere. And this could reduce some costs, of course.
I think that's probably the answer. I've been using it many times in terms of trying to promote mental health care, because obviously what we hear from healthcare providers, insurance is always how much is it going to cost? And I think this is probably the way forward. As you indicate, we have to guide decision takers in our society to a view where they acknowledge that such changes in the mid and long run will actually save them money. So it is, I'm afraid, the economic argument. Other arguments probably don't really have that impact on them. I have a next question. How well is eco-nursing present in Luxembourg?
Do you mean implemented in Luxembourg?
Properly implemented, is it there? That's how I read the question.
I probably don't have the exact answer, because I didn't make a study to do an inventory about all the different initiatives and innovative strategies maybe always implemented. What I know that some hospitals, of course, already in Luxembourg have thought about that question and have dedicated some professional healthcare in the healthcare sector to change some strategies. I don't want to cite now those hospitals here, namely, but I know that they are, of course, already in initiatives, and they want to be also strengthened. and they will be, I think, improved and enlarged in the next month or years, probably.
That will be very interesting to monitor, I think, because as we all know, Luxembourg is a very small country, so any changes implemented should cause an effect after a relatively short period of time compared to larger countries. So any changes in a large societal sector such as healthcare, for example, ought to be visible relatively quickly. So I think we're all very excited to see changes being implemented. I have a next question here, and that reads, don't you fear that adding sustainability and environmental health issues to the nursing profession will increase the stress and pressure on these professions, which are already very stressful and demanding?
I do not think so, because if we integrate in sustainability not only the things that we have to do for to improve in the environmental health, but also to include how can I care for myself, how can I be in some balanced way aligned to my values, to the environment in which I am, and also have some impact maybe for changes. This can has an added value and can help us to be stronger and to be also, I would say, a bit satisfied about our different actions. So I think it's not only about providing strategies or acting for to improve environmental health, but it's really to integrate how I can care for myself and for my community in those changes. Because as I said, addressing eco-anxiety relies also on factors we can improve for ourselves. And I do not think that resiliency, for example, is only about personal factors that we have to change or that we have to improve, but it's really this interaction with our environment. And I think if we can have some impact or power with other people, not to stay alone, but with other people, and to have some very small changes maybe at the beginning, this can help us to feel better. I don't know if I really responded to your question. It's a large discussion. We can continue.
I think you've highlighted the many issues that are there. I have a next question here, where I could actually replace nursing with psychotherapy, so it could also be a question to me. The question goes, nursing and caregiving relies on communicating in situations often existential and intimate. How can multilingual teaching in nursing and perhaps use of computer-based translation tools be implemented to serve sustainably the hyperdiverse Luxembourgish context?
That's a very complex question. So if I understood well, maybe I will reformulate, if I may, Klaus. You would say, how can we use technological devices to better communicate with a very multilingual population? No.
Well, that's one part, but I think it's the multilingual aspect as well. You know, I mean, I've just highlighted that Luxembourgish is a very good test bed for such things that we want to do and that you want to do. But Luxembourg has its own challenges, and its multilingualism can be a big challenge, I think. So there are very many aspects in relation to teaching that are affected by people using different languages. How would you address that in your bachelor program? I think that's how I am reading the question.
So I have two elements I would like to share with you, and they are not exhaustive. So they are probably only some introduction. Multilingualism here in Luxembourg, of course, is linked also to the fact that, as I said, there are 70% nurses from cross borders entering in, who are not multilingual sometimes.
Okay.
And if the government decided, yes, to mandate the university here to have new bachelors, which is linked for Luxembourgish people, to have Luxembourgish nurses. In our population, we have since September, they are 80% Luxembourgish, so they are multilingual. They speak already all those languages. So I think in 3 or 4 years, Luxembourg will have their own Luxembourgish nurses who will be able to provide care in several languages, but it will take time. I think multilingualism is also linked to culture, and we have implemented and we want to implement courses about multiculturalism competences. How, as a nurse, can I address cultural issues for our patients? And the language is only one part of that. It's really to ask ourselves what matters to this patient. And if he's from that nation, from that country, or from that language, it's, I would say, secondary. It's maybe a bit provocative, but I think the nurses have to have in their mind that the most important is to address cultural competences and to know which is important for that patient on that day.
That's a huge challenge, I think, but one where Luxembourg would be the right test bed, I think, to see how that can be implemented in such university training. Before I get on with the next question, maybe I can ask a question myself. And as Mathieu has mentioned, I'm the director of the master program in psychotherapy, and I think I'm therefore aware how complicated it can be to marry up the sometimes very different agendas of the university, ministries, and professional associations when it comes to training of healthcare professionals. Can you give us a glimpse of how you did that? Do you have any tips that I could learn from how to maneuver this sometimes quite difficult path?
Oh, I don't know if we are models. We try only every day. So we try to put the persons around the table and to help the communication be a little bit more fluid between some stakeholders, between ministries, universities, and our nursing unit and associations. And I think the communication part is probably the most important part, or in which we invest in our department, in our unit. It's never done, it's never complete, and it will never be completely reached, but and also to be the most honest possible. So to be authentic, to say here we need that, or this is important for us, and or maybe these aspects which are imposed, we can live with it, or those aspects are just unacceptable. So to be very authentic and to talk with the different persons and stakeholders to share those views. This is our strategy, I would say.
That's encouraging, thank you. There is a next question that I'd like to read out to you, and it reads, you are, I'm sure, quite familiar with the recent scandals with the management and care in the homes for our elderly. Relating to eco-nursing, what do you think of it? Care and sustainability seem quite unimportant compared to profitability. Could eco-nursing be one of the solutions?
Maybe, I don't know if eco-nursing would be the solution, maybe it would be a part of the solution or a part of a pathway at least. As you said in the introducing this question, there was yes, the scandal about also more the economic beneficence of those institutions. In different countries, it's sometimes the same problem. But I think there's another thing. It's also the view, the perspectives we have in our society about elderly people, about the care which can be provided in those institutions. You know, for a nurse, it's often more, I would say, the social recognition to reanimate, to resuscitate patients is much more appreciated and recognized. But to care for elderly people, it's not so recognized, and it should be. And now in the next decades, we will have so many elderly people for whom we will have to care. So I think there should be a shift also in the social recognition of this type of care. That's the first element. And also to provide qualified nurses in those elderly institutions. Now we are in a tendency where we would like to have a lot of workforce, which will not be very trained or not very qualified, only because we need a certain number of nurses or of low quality, I would say, healthcare professionals. I think this is wrong. If you want to have you and me in 20 or 30 years, nurses, we would like to have them qualified and to have them trained to take some actions, because it's a lot of complexity in the morbidity which those patients will have and will have as a profile. So I don't think that's a good way to go towards creating other profiles of healthcare professionals which will be less trained.
Thank you. I have two more questions here, and one is, do you think that we should also have an eco-medicine course? Because medical doctors and nurses work together in the clinical side.
That would be excellent. And I'm very open to have in our classrooms medical students, and we will talk with our colleagues here at the university, of course. If we can mutualize, this would be good. We have some other perspectives of mutualizing some courses with our colleagues from the medical education, of course.
There is
Thank you.
Very interesting next question. Designers work on improving our everyday life and environment. In your multidisciplinary approach, have you worked or thought about integrating designers or creative people into the process?
I love this question about design, and I first try to have an office which would be designed for me. And the first question my first meeting with the new rector, with Jens Kreisel, was, oh, it's lacking sheets here in Belval University. And I don't know if he will see this webinar today, but I'm very happy to show that we have one sheet now here in my office. And I hope maybe that there will be a manifesto of several hundred sheets walking by in Belval to have more hybridity in a very mineral, I would say, environment here. But yes, for example, Cynthia Fleury, which I quoted in my presentation, she works with a designer, and they did, for example, a garden in a hospital in Paris, a garden which was designed by nurses, by healthcare professionals, by designers, to have some respite, to have some resourceful places to rest, to have some silence. And there are some other initiatives in other hospitals, for example, in France and Belgium, but also in Germany, which, for example, patients can have a garden and help within this garden and have therapeutic effects. For example, a very innovative project also in France for patients with Alzheimer have rebuilt a small city where they can walk around very freely, not to be constrained in their rooms, in their bedrooms. And these are those types of, I think, infrastructures and environments we will have probably, yes. And I would like to work with designers to reflect and to help hospitals and other institutions to integrate this into their therapeutic pathways.
Thank you, Marie. Again, I have a question myself. In your view, has the pandemic had some positive effects, for example, highlighting the current, well, the ongoing situation with nursing shortages in our society?
Mm-hmm. Yes, for example, in Luxembourg, it was really an awareness which came from the pandemic here in Luxembourg for the government to invest massively now in those new nursing bachelors at the university. So I think there was a shift, yes, or some provoking elements, events, which came to that conclusion that we all will need nurses now and in the future. So if we cannot care for nurses, they won't be able to care for us. And I think the pandemic, yes, I think so, has increased this awareness among politicians.
Yeah, I mean, what I remember, in the early days of the pandemic, there were these pictures on television where people applauded on balconies, to acknowledge the work that they appreciated that was done by the frontline workers. But, over the months, it sort of melted away. So I think it's in another way, I could say, we need to make it sustainable. People's appreciation of the work that is being done by the nursing profession.
Yes, so the support must come from, of course, governments, institutions, universities, I think, but also from nurses themselves. So help nurses to have a voice, to be courageous and not to be, I would say, aggressive, but affirmative, assertive, and to document really what they're experiencing, what is needed, because they have the competence and they can know exactly what should be done. So they should be invited around the tables or invite themselves around the tables if they're not invited, in a very, of course, diplomatic and respectful way.
I think that's a very good way how to end this session. I can't see any more questions at this moment in time. I'm impressed by, for example, and perhaps most importantly, by your last statement that it's about being affirmative but non-aggressive in putting forward an agenda that is there to safeguard humanity and the planet.
Yes, absolutely, I agree.
Over to you, Mathieu.
Thanks a lot, Professor Friedel. Thanks a lot, Professor Vögele. So I really hope that you all enjoyed this presentation and this discussion. It was very, very interesting. And once again, thank you a lot. So the video of this presentation will be available online soon. I will work on it, and it will be on the website of the university on the sustainability page. I invite you all to visit the page to see the future lunch talk. So the next one will be January 18. It's the same format online, and this time we will host Dr. Céline Schall from the FHSE, and together with Anouk Vis from the CRC, Anouk who asked a question earlier today. The subject will be different, but still around sustainability, of course. It will be the ecological and social transition of the cultural sector. So also a very interesting subject. Don't forget once again to visit the sustainability webpage, to subscribe to the sustainability letter, and yeah, thanks a lot again, and I wish you all a pleasant afternoon.
Bye-bye, everyone.
Bye.
Thank you, Laurent. Thank you, Mathieu and Klaus. Thank you.